A friend to a client who had her body done a few months ago, she reached out because she also wants to get her body done. She loved the outcome of her friend's body, and so she wants to get her body done. But she has some concerns, and these concerns are because a friend of hers, that another friend of hers who belongs to a social media platform, sent her some photos of complications such as liposuction burns, fat necrosis, and tagged it to Cynosure, saying that Cynosure is a facility that gives complications like the fat necrosis and then the burns. But she now wants to get her body done, obviously, but she's skeptical, she's hesitant. Now, how would you address such concerns? Because maybe she was the only one who reached out, but then there are lots of people like her that wants to do her body, that wants to do their body, but they are scared that no, they don't want to come here because they don't want to come down with burns. So now, how would you alleviate her fears? How would you also educate people about things like this?
Okay, thank you very much for the question. To be very frank, it's a very common question. People send me messages. I get forwarded messages from different clients and things like that. You see, first, liposuction and fat transfer have its attendant risks and possible complications. Now, the most common complications that could happen after a liposuction is lipoburn, right? And then when you now look at those who do fat transfer, the most common complication they can have is fat necrosis. And then very rarely there could be fat embolism. Now, let me start by saying that we have never had any fat embolism in our facility.
Wow.
Yes. Proven, even autopsy report have also confirmed that. Now, let me say that complications generally can arise, right? And we have had a fair share of complications, talking about fat necrosis, lipoburn, or even death, unfortunately. And our heart goes out to all those who have had any of these complications. But the truth is, this complication arises from any facility that has done a number of surgeries.
Wow.
Complication rates are a percentage of the number of surgeries that are done anywhere in the world.
Mm-hmm.
What that means is that if you want to do any procedure, first ask yourself, what is the risk associated with that procedure? What is the complication rate of that procedure? If you look at fat necrosis, many statistics will quote anywhere between 20 to 30% complication rate. Now, even in developed climes, complications can still arise. And when a complication arises, it doesn't necessarily mean that it is as a result of the facility inadequacies. Quite a number of times, some of the predisposing factors to complications. If you go to a facility where you have a well-trained surgeons who are not just doctors, but now consultant surgeons, and also belong to professional bodies where their reputation is at stake, where they are held to high ethical standards, they are very cautious of how they do the procedures. By the way, a facility that can do surgery so well that people like, that's given the facility multiple ratings, multiple awards, can't that facility also know how to prevent complications? Of course it does. It's just that some things are just unfortunate to happen. Some clients have even come from out of the country to fix their complications right here in our facility, apart from the ones that we do regularly in Nigeria. We fix complications from Turkey, from even far away Dominican Republic.
Wow.
Oh yes,
Wow.
I mean, it's not about mentioning names. It's just to tell you that it is universal.
So you mean to tell me that you've done revision surgeries for clients who have done their body outside Africa as a whole, not just Nigeria, even after
Of course.
outside Africa.
Yes, of course. The revision surgery is not just the regular revision surgery. Some people come for revision surgery just because they want to have an additional augmentation also. But I'm talking about issues. Yes, we have fixed issues relating to surgery done elsewhere out of the country. And of course, even within the country. And we don't make any fuss about it. Now, I'll tell you some things that is quite interesting. For any clients planning to have surgery, I would advise that you should book for early consultations. Do not come because you just got money and you're ready. Sometimes you are ready, but your body is not exactly ready. You need time to detoxify yourself from some social habit, especially smoking.
Now, this early consultation you talk about, is there a range? Since we are educating people, is there really a range? Some people can have the money now, and maybe
Correct.
they'll be like, okay, I'll get my body done next month, so
Exactly.
let me go for consultation now.
Good.
Because there's a saying that money is like spirit. So maybe they've really kept money for that, and they just want to do their consultation and then go for the surgery. So is there a range to when or as to how early their consultation should be?
If you ask me, I would just say anywhere from 3 months.
Oh,
If you are doing your surgery in about 3 months' time, you can start your consultation now. This is because you are going to be placed on some drugs that will help you boost your blood, that will help you strengthen your immunity, strengthen your nutrients, vitamin C, folic acid, fesolate, and all of such drugs, even zinc and other things, even amino acids, right, and protein. You need to get your building block ready, like a reserve, before you go for surgery. That on one hand. On the other hand, you should also stop some social habit, smoking especially.
Wow.
But there's one funny thing we see. Some lady will tell you, I do not smoke. And that could be true. They don't smoke, but they hang around people who smoke a lot. They go to clubs, they go for birthday parties where people smoke in a closed environment for hours, and then they think I don't smoke. Whereas the effect is probably even worse if we're in that kind of environment. So if you have to do your surgery, give yourself time, have an early consultation so that you can get to know a whole lot about you. Don't say, my friend did it 2 days after she paid for surgery. I mean, it's not always like that. Of course, people do it. We've done that, to be honest. But it's not the best way, right? When you do it like that, many come out very well. But I'm talking about optimizing even your time. The best time, give yourself time, prepare your body for the surgery as much as you're also preparing financially for the surgery. And then I also want to talk about those who have concerns about complications, right? I'm going to be showing you some of the things that you see online that happens in all parts of the world, and you see the figures for yourself. Follow me. So you see, now let me show you what percentage of BBL clients develop fat necrosis. This is the result using the AI mode search. Survey of plastic surgeons showed that approximately 23.6% of Brazilian butt lift BBL develop some degree of fat necrosis, and published by PubMed Central, PMC, and that's a US publication. And then you can see, when you read this, you will see that in the range, it could be up to 20 to 30%. Obviously, they checked something like an average and they got that. These are documented evidence. And of course, some of the most common causes of fat necrosis would include high volume fat grafting. That is high graft volumes. High graft volume meaning that if you are grafting more than 500 cc per side, the risk gets higher. If your volume is less than this, trust me, the risk is much less. So now, for you to have high volume, it means you're having more than 500. And guess what? Most clients, especially in this part of the world, want much volume than 500. I can tell you that. Okay, so you see, the higher the volume, the higher the risk. It's as simple as that. Then the premature pressure. This is some people say They were told that you can sit at 3 weeks. I don't preach 3 weeks. We preach 6 weeks in this facility. So that means we want to give them much longer time to heal before they can sit down or lie down or put pressure on that part of the body. See, sitting directly on your butt or resting on the graft zone during the first few weeks physically constricts micro blood vessels and cuts off critical blood supply that would have given oxygen to the area. That's one. Another thing. Then now look at smoking. Nicotine severely constricts blood vessels and drastically dropping the survival rate of the newly transferred plant. These are verifiable information. Okay, an aggressive process here. Harsh harvesting of rapid injection technique can damage the cells, right? Yes, these are some of the things that can cause fat cells to die, and these are very well-known facts. It's not peculiar to any facility. So you see the figures. Now let me expatiate on this. When you say 23.6%, you know what that means now. Out of 100, you could have as many as 23 clients coming down. You know, it doesn't mean that you always have 23, but that's the average statistics. These are not my figures. It's figures from all around the world. This is a publication that posted that. So when people tell you, oh, Cynosure gives this, Cynosure gives that, they are just mischievous. I can tell you that. Okay, so let's now look at lipoburn, liposuction burn. The question here was, what percentage of clients develop liposuction burn after liposuction? And here what it gives us is air overview. Between 0.25 and 5% of liposuction clients develop skin burns or thermal injuries. When you see this, what that tells you is that out of 100, you have about 5%. Let's use the maximum figure they give there. In 100, you have 5%. That's the meaning of that statistic we just saw. Okay, and then look, what are the causes? Traditional versus energy assisted. In this facility, we like to use the traditional for reason that we want to reduce the incidence of what? Fat lipoburn. Because energy assisted facility devices like the laser assisted liposuction or the laser liposuction, which uses ultrasound to produce heat to try to melt the fat for easy suctioning with the machine. All of these deliver energy onto the skin, and the energy can actually cause burn if it's not well regulated or if the technique is not right. It's not always the heat, right? It can also be the friction from the cannulas, and then of course, if there is also high risk factors. High risk factors meaning those who smoke. Some people could have just minor bruises that would otherwise have healed from liposuction. But this risk factor will now increase the chances of those bruises developing into full-blown microburn. Or, for instance, some people use compression garment that are too tight. You know, if the garment is also too tight, it can increase the risk of lipoburn in the clients who are just having liposuction. So you can see that these statistics are not peculiar to any facility. You know, so that's one of the reasons why this happens. So we can now, based on knowledge of these things, avoid it. We do not use energy assisted because of that. We have to, but we do not use it.
Okay, you see from the statistics I just showed you, you can see that complications are not peculiar to Nigeria. Not even Cynosure. Cynosure is even too small to talk about. Complications are not peculiar to Nigeria. It's everywhere in the world. Now, but there is a unique problem in Nigeria, and I'm going to tell you that because quite often people are people trying to shy away from addressing some issues. We have a burden problem in this country, and the problem is that we have because people think, oh, plastic surgery, cosmetic surgery, aesthetic surgery, there's a lot of money in it, so you see a lot of people attracted to that industry, and that industry has attracted every set of people, the good, the bad, and the ugly. Now, what we have are people who have come together to think, okay, this is an opportunity for me to make money. What do I mean? I've had people call me to tell me, they want to pitch me, and they have something to tell me and things like that. And I book an appointment with them. And by the time they come, it's all about, oh, I have many clients I can send to you. What I do, I meet with a lot of clients, possible clients. Can I be sending clients to you and they give me a percentage of what they pay? And then some will also say, oh, I just add my price to it. If your price is X amount of money, I will just add my own commission on top so that you tell the patient to pay X plus one kind of thing. And you see, this is frustrating. For some of us are very old school, right? By our upbringing and our ethical values, both in the military and in the medical profession. We abhor such things. Many have come and we have turned them down politely. Say, sorry, I can't do this. I cannot do this. If you ask our customer service, whether you're coming from out of the country or from within Nigeria, it's the same rate. We do not have a set of prices for those who are coming from out of the country, or those who are in Nigeria, or those who have been referred by other people. I mean, that's racketeering. And we don't like that. So this is the number one area where we have stepped on so many toes, I will say. I have to be very honest with you. We have stepped on toes, and I know that. Some have come and said, you see, guess what? Some have even been our clients. They've done the surgery and they're looking hot.
With a banging body.
Banging body, they're bloggers. In fact, they come and tell you that, oh, people are asking me where I did my body. I said, but you know where you did it? I said, no, I have the right to not tell them where I did my body. Of course, you have the right to say anything you want to say. But please, can you leave us out of it? Well, guess what? Many of them go around blackmailing us because of any complications that might have arisen from our facility. And then somebody tagged us and I looked at it and said, this is not our signature now. This is not our signature. What have we got to do with this? And within a few days or so, I saw an apology from the same blogger. I said, oh, sorry, this was an error. It was not from Cynosure. My question is, who is that person that will sit down and send a picture to a blogger and say, Cynosure gave this body to me? Is that unbelievable? That is believable. She didn't say, Cynosure gave this body to my friend. She said, Cynosure gave this body to me. This is the body Cynosure gave to me.
Wow.
And I said, this is not our signature. It was when I now saw the apology from the lady. And I said, when my customer service showed it to me, I looked and said, you see that? Who are these people? What has not happened, they say it has happened. Even when we have had the effrontery to put out our statistics out there, people will still tell you, no, it's not correct. That's not what we've heard. You know? I remember back in 2022, when something happened and we were dragged, everybody was talking about Cynosure everywhere in the country and out of the country. And then, you guess what happened? By the time the whole truth came out, and our CCTV camera, which we installed shortly before the incident happened, showed that she was giving a drug from outside, a drug that had a lot of caffeine. And this patient was taking the drug without even telling us or telling the nurses. She was taking this drug and then she had caffeine toxicity. And little did we know, we were even thinking, oh, could there have been blood transfusion that she had at that point in time or things like that. You know, these are things that have happened. And people will still tell you, oh, I saw this video, this is where something happened, And how much are you going to say of such things? That, for instance, that case was not a surgical death. It was even almost like a manslaughter. But the family were not ready to pursue it, and then they withdrew the case. That was how the case died down, and some others like that. Issues like that, some will tell you, oh, some people exaggerate, even real life burn that has happened in our place. You know, and can I even shock you? Clients could be on admission, and then she will tell you people are calling her to send their pictures, if they have any issues, so that they can publish it in a social media blog. I said, what is that? And I said, I don't know these people. I don't know who gave you my number. I don't know why they are calling me. I'm talking about our real clients who have raised such concerns. So the question now is, who are these people? So what Nigerians should be careful about is that you have this group of people whom you think they're helping you, but they're actually helping their pockets, right? They will tell you, oh, these people are good, but you have competition. Scare factor, right? They want to scare people away to their own preferred client facility where they probably are giving commission, or they can get whatever it is that they get from such facilities. For us, as plastic surgeons, I know my colleagues, we're not desperate, for heaven's sake. In the university where we trained, and also in the residency training programs where we trained, and some fellowship that we had, we always have things we call morbidity and mortality review. It was in that sense that we could post statistics of even death that we've had and the cause of death. I don't know any other facility that has done that. If we're not bold, if we had things to hide, we will not be doing that, right? So the truth is, our economy is really making people not think well. It's unfortunate that people think, okay, this is their own way to make money. If they have to rubbish the country, if they have to rubbish a facility, if they have to rubbish an individual, they will do it. There's nobody Nigerians cannot abuse on the internet. People who want to make money from facilities go around blackmailing you and tell you, I have turned out many. Some will even come, they want to see me, and tell them, sorry, I don't want to see this person because I know why she's here. I do not know how to tell them no. It's that bad. And then eventually you have to come up and say, sorry, I can't do this. And the moment you do that, you have become enemy number one. Oh yeah. Including those who have had their bodies from us. I can tell you that. They know themselves. They know themselves. Yes. When anything bad has happened, right, in any facility, in the same environment, it should be, oh wow, what has happened? Oh, how can we not let this thing happen? But many of them latch on it, thinking that it's an opportunity for them to get more clients who would have gone to that facility, right?
Yeah.
But it's not about you. Many of them lack patriotism. They lack ethical. Of course, we are already held by ethical standards, by regulatory professional bodies. That's why we are not desperate. But the people who are desperate are those who are not plastic surgeons. I can tell you. I'm sorry, it might sound like I'm shaking the table, but I can shake it if I have to, because we have to protect the industry where we should belong to. I'm a plastic surgeon. I have colleagues, and you have these people bullying. They actually bully us. They bully plastic surgeons. These are people who think they can recommend. Some of them even charge as much as 200,000 naira to refer you to a doctor. And these are doctors you already know, surprisingly. So my advice for Nigerians is that, please, for heaven's sake, do your own research. If you have a place you want to do, talk with your friends who did surgery. Stop going through these syndicates and their racketeers. Stop going through them. If you have a friend who has done a procedure and you love her body, for heaven's sake, go to the surgeon who did the body. She will tell you. So if you go around asking questions around, thinking you are doing something, you'll get confused. If you want to even find out things, find out by yourself. The facilities are there. Go there, see for yourself, ask questions, discuss with these surgeons. If you have to pay a consultation fee, which is a token, by the way, for us it's 40,000 naira for a consultation. But some other places is 50, some other places is 100,000 naira. But these people can charge as much as 200,000. I'm telling you from clients who have eventually come to me. I said, but we are here. I said, no, they didn't tell me. He will not tell their colleagues, their friends, or even if they are not friends, people who approach them online to say, where did you do your body? So it's an office. It's their own marketplace where they think they are making money. So they can do and undo. They don't care whose ass is God when they're trying to line their pockets. That's where we are now. And if we don't speak out, they will destroy this industry, right? So what? And unfortunately, there's no regulatory body for them. There's no regulatory body for them. So that's why I'm urging Nigerians to please use your brain to find out If a facility tells you that they've never had any serious issue, then you should even run. We are 9 years. We're going to be 9 years in September. A facility that has been on for 9 years, we've done thousands, over 30,000 surgeries. These are not figures for babies. These are figures for adults who can understand, oh, wow, this is something, for us as doctors, we're already held by high standards. We know we have regulatory bodies, we have senior colleagues, we have regulatory bodies that regulate hospitals, that regulate facilities, doctors and our practice. And we belong to professional bodies, which makes us board certified. We also belong to professional bodies even out of the country. So these are things that plastic surgeons in Nigeria are quite, scared of saying, or because when you say they come for you. But there's time to say, but even the Bible says there's time to be silent, there's time to speak. Mm-hmm. Oh, yes.
Another thing I want to remind you of was that some time ago there was this trending thing on social media that people were complaining that they were being attacked, where they talked about people ganging up together to attack successful brands, and then a lot of them were hair vendors, some were other business people doing some other businesses, and they said people could just come around and then blackmail them or even try to take down their pages, I tell you, some of those things have been happening in the plastic surgery industry.
Also in the plastic surgery industry?
Yes, we've been saying that. Wow. We've been saying that because of this same issue. People think the controller of who goes to where in plastic surgery. And they've been doing that. For us, particularly for me, I trained in the army and I was privileged to be the first director of the Directorate of Monitoring and Evaluation. That directorate was started by my humble self and was supposed to be the facility monitoring agency in the army.
Wow.
What that meant was that we were like the farmer of the Nigerian Army, meaning health facility monitoring and evaluation and accreditation agency.
Okay.
So what we were doing was to actually standardize medical practice in the Nigerian Army facilities. So we have actually imbibed a whole lot of ethical values, right? So we are self-evaluating in terms of holding ourselves to the highest standard of care for all of our clients.
Wow, yes. That's really so amazing.
Thank you.
Hearing you speak, I've been so enlightened with this section, and it's really been so amazing. Thank you so much, sir. Thank you.